So in this section, we're going to talk about taking the 30 years of laboratory findings and rolling these in, translating them into a meaningful clinical approach that now attacks cognitive decline. So the question then is, how do we go about developing an effective treatment for an incurable illness? Well, by starting with asking, what is this incurable illness? What does it actually do? How does Alzheimer's work? And then trying to target the things that are actually the upstream drivers, the root cause of Alzheimer's and the root contributors. As I mentioned before, if we had a perfect drug, it wouldn't just go after one thing and be blindly treating and look at just taking a pathway that may have nothing to do with the cause. It would actually have to do the following. So you'd actually have to do something that impacts many different molecular drivers of the cognitive decline. So let's measure those and then let's impact those with the various modalities we have at our discretion. So, okay, let's talk about Alzheimer's disease. Let's talk about people who are symptomatic, be they symptomatic from earliest stage, subjective cognitive impairment, or middle stage, so-called mild cognitive impairment, or the late stage, so-called Alzheimer's dementia, the dementia stage of this disease. By definition, that means SCI, you know there's something wrong, often your spouse knows there's something wrong, but you're still testing by definition in the normal range. So to some extent, this just depends on what test you apply. That can last a decade, and then MCI appears typically, and this is when you know there's something wrong, your spouse and coworkers may know there's something wrong as well, but now the tests are also showing it. That's so-called MCI, and then that about 5 to 10% of those will convert per year into full-blown Alzheimer's disease. By definition, that means that you've now begun to lose activities of daily living. So you can see what we call Alzheimer's dementia is actually the end stage. It's a little bit like saying widely metastatic cancer. It's the end stage of a process that's been going on for about 20 years or so. So in Alzheimer's or in symptomatic cognitive decline, SCI, MCI, Alzheimer's, then the first thing we want to do is we want to use an algorithm to subtype, and we'll talk about the subtypes in a few minutes. We want to now be able to tell people that this is mostly inflammatory, or this is mostly atrophic, or this is mostly toxic, or mostly vasculopathic, or what have you. And we then want to address each contributor. When we address these, we want to start with the basics that turn out to have a big impact on this disease. So the beginning is DESS, diet, exercise, sleep, and stress. It turns out that these things play a huge role in optimal cognition. And I think we've all had that experience where we stayed up all night. When I was an intern, there were times when I would stay up all night, all day, all the next night, all the next day, and sometimes a third night. And of course, I couldn't think nearly as well after a few days of staying up all night. It's really a disaster, as we all know. So getting optimal sleep, getting optimal diet is very helpful. Now, what is the optimal diet? And most people are coming to the same conclusion, that it is a mildly ketogenic diet. We want to target about 1 to 4 millimolar beta-hydroxybutyrate. It is a plant-rich, high-fat, intermediate protein, low carbs, very low simple carbs, hopefully zero. And then, so that's the sort of approach we use, which we call Keto Flex 12-3. It also includes fasting. If you're ApoE4 negative, we want to get 12 or more hours of fasting between finishing dinner and starting breakfast, brunch, or lunch. And we want to get at least 3 hours between finishing dinner and going to bed. If you're ApoE4 positive, you really want to get up 14, 16 hours or even more. Be careful, if you're very thin when you start, it's going to be harder to do the fasting, and you're going to want to slowly work into this, and you may want to take some MCT oil, things like that. You want to get your ketones up. And then what you want to do in the long run is be able to generate endogenous ketones, because the ketones fuel the brain. We want to get off the carbs that are actually damaging the brain and onto the ketones that are supporting the brain metabolism and supporting the mitochondrial activity and supporting oxidative phosphorylation, basically. You are fat burning now instead of carb burning. And so with that, we call this Keto Flex 12-3. You want to have a level, whether it's exogenous, which is what we use to start, and then slowly we can move over to endogenous, which has some additional advantages. But initially, you want to make sure that you have enough ketones there. And then secondly, you want to do exercise. Both cardio and strength turn out to be helpful. The cardio has specific advantages in terms of oxygenation, for example, and mitochondrial function. The strength has advantages in terms of insulin resistance. The strength training actually helps you get better insulin sensitivity. So they both have a role to play. And then sleep. And one of the most common problems that's overlooked is that people don't check for reduced oxygenation. Everyone thinks, well, if there's not a lot of snoring, they probably don't have sleep apnea. Well, first of all, a lot more people have sleep apnea than realize it. About 80% of people with sleep apnea go undiagnosed during lifetime, and it has relationship to all sorts of things, of course, from gastroesophageal reflux to cardiovascular disease to hypertension to obesity and to cognitive decline, and by the way, also to macular degeneration. So all of these things are impacted by that reduced oxygenation at night. Critical to find out. You can do a classic sleep study, that's fine. You can also simply have the person wear an oximeter at night for a couple of nights and just check to see whether they are dropping. They should be 96 to 98% in their oxygenation, saturation, SpO2, while they are sleeping. So whether it's because of sleep apnea or things like upper airway resistance syndrome or other reasons, if it's dropping down at night, then you need to treat that. That's going to give you the best chance of reversing cognitive decline. And then stress. And it turns out, of course, acute resolved stress is standard. That's something that's hormetic and isn't terribly damaging to us. It's the chronic unresolved stress that is so damaging to so many of us. And of course, that's a big player in our many chronic illnesses of today. And then the next thing is oral health. It turns out that oral pathogens, when you look in the brains of patients with Alzheimer's, what do you find pathologically besides the plaques and the tangles? You find oral bacteria like P. gingivalis and T. denticola and Prevotella and things like that. You find herpes simplex from the lip. You find HHV6A, which probably comes in through the sinuses. You find various fungi and molds and yeast, things like Candida and things like other molds, Stachybotrys and things like that. And then, of course, you also find Borrelia of Lyme disease. So all of these things are critical. And then, of course, oral health also critical because of mercury amalgams, because of periodontitis and gingivitis. So these are all basic things that should be addressed to get optimal outcomes. When you've addressed the DESS, and this actually has big impacts on people, now also you want to add brain training. So stimulation with training turns out to be really important. And people have looked at this as a monotherapy. And it certainly has some important impacts, very good for prevention. But once we have symptoms, we also want to add all these other things as a way to support that brain training. And we have typically used Brain HQ, which from Posit Science, started by Professor Mike Merznick from UCSF. And we've used that because that has the most published literature that supports its use and its production, how Professor Merznick actually put this together to begin with. And then, of course, we want to heal the gut, and once it's healed, use probiotics and prebiotics, which you can get from foods, which is probably the best way to do it, or you can get from supplements. But the bottom line is, of course, it's turning out that the microbiome is critical in many things. And the fact that so many of us have leaky guts and that they contribute to systemic inflammation and therefore ultimately to cognitive decline is huge. And therefore, healing the gut and getting the optimal microbiome huge. And by the way, if you actually look at gut microbiome from Alzheimer's patients versus non-Alzheimer's patients, there is a difference. And in fact, you can actually improve the gut of the patients with Alzheimer's. You can actually do this with transgenic mice and show that you can actually improve their cognition by optimizing their microbiome. So it turns out that this is very important. And then the immune system. And again, when you look at what Alzheimer's actually is, It is a protective response. It is part of your innate immune system. So you are looking at a critical role of the immune system in this phenomenon. And what happens in Alzheimer's for most of these people, it is a chronic activation of the innate immune system, which is why you're getting the amyloid production. And yet the adaptive system is typically not doing its best job. You're not getting eradication of the viruses. You're not getting eradication of the various bacteria. So to some extent, there's another mismatch there. One of the things, interestingly, that happens when you take, for example, vitamin D and omega-3s, you're actually improving your phagocytosis, which improves your ability to hand off from the innate immune system to the adaptive immune system, so you can get both cellular and humoral responses to these. So optimizing your immune system, optimizing your methylation, high homocysteine associated with poor cognition and increased risk. Detoxing, huge issue. So many people have turned out to have toxin-associated Alzheimer's disease. And for example, A-beta, not only is it an antimicrobial peptide, it also binds metals like iron, copper, zinc, mercury, things like that. So detox is a huge issue, and that's actually been the toughest type of Alzheimer's to treat, Alzheimer's associated with biotoxins, mycotoxins especially. And then hormones. So if you want to give someone Alzheimer's disease, one of the things that you want to include is to drop their hormone levels rapidly. So no surprise, nice work out of the Mayo Clinic years ago showed that women who have early oophorectomy at the age of 40 or younger, who do not have BHRT, bioidentical hormone replacement, actually having double the risk for Alzheimer's disease, even though the Alzheimer's is being diagnosed much later, as we talked about earlier. And then trophic factors, so increasing, for example, your BDNF, which can be done with exercise, can also be done with supplements such as whole coffee fruit extract, for example. These are also critical. And then optimizing metabolism, one of the most common abnormalities in metabolism in cognitive decline is insulin resistance. And we want to produce insulin sensitivity, and we want to produce metabolic flexibility. And then we want to target the identified pathogens. So if you've got herpes simplex, and in fact, suppression, very interesting studies from Taiwan showed this dramatic effect of suppression. People who developed HSV1, for example, who used suppression and treated the outbreaks were less than half as likely to develop Alzheimer's disease as those who did not treat the outbreaks. So big impact of treating those outbreaks. So if you've got targeted pathogens, herpes simplex, Borrelia, P. gingivalis, etc., you want to target those as well. And then you want to target the identified toxins. And there was an interesting study, for example, from Finland, showing that men who actually you would use sauna as part of a detox were about 60% less likely to develop dementia when they used it most days of the week than those who did not use sauna or used it much less. So again, detoxing very likely to be quite important. If you've got high mercury levels, that's something that can absolutely be treated, and we've seen this again and again with people improving with their cognition when they reduce their mercury levels. Trichothecenes, for example, from the Stachybotrys typically. These are one of the mycotoxins. These are horribly toxic and in fact can be associated with dementia. Gliotoxin is interesting because it's very common, typically associated with aspergillus, for example, or penicillium. And this actually has an immune suppressive effect. So again, we're back to things that can suppress the immune system, leave you with this chronically activated innate system without the ability to clear by activating the humoral and cellular adaptive immune system. So target identified toxins, critical, especially for the people, as we'll talk about when we talk about the subtypes, the people who have type 3 or toxic Alzheimer's disease. And then optimize the vascular system. Many of these people have poor vascular support. Many of them have peripheral vascular disease. So this is important. And this, of course, is not just getting your lipids into good shape, but also considering improving any poor oxygenation at night, and consider EWOT, which is exercise with oxygen training, where you're actually using 100% O2 for about 15 or 20 minutes while you pedal a bicycle typically. So you're increasing blood flow and you're increasing oxygenation. And this is actually helpful to many people who have poor vascularization. Now, after you address all the things that are doing this, give these people 6 months after they get on an optimal program, and then consider stem cells. And there, of course, there are many stem cell trials ongoing. Unfortunately, they're all monotherapy stem cell trials where you're just giving stem cells alone. And we always make the comparison. This is a little bit like trying to rebuild a house as it's burning down. It doesn't really make a lot of sense. First, you want to put out the fire, then you want to rebuild the house. And so what we'd like to do is we'd want to address the very things that are causing the cognitive decline and then add the stem cells. But certainly people are reporting good results with stem cells as part of an overall approach to cognitive decline. All right, what about for the people who are interested in prevention? And thankfully, this is becoming more and more common. People will say, well, this is very common in my family. I'd like to get on prevention. Now, what you'll find is these people are basically in one of two groups. Either they're there for prevention, and when you test them, in fact, it really is prevention. They're doing just fine, their cognition's great, and they're truly there for prevention. But fairly commonly, what you'll find is people who are there for prevention, in fact, are already suffering mild cognitive decline, and either they haven't recognized it or they've kind of put it out of their minds. And a simple example, we had a patient who came for prevention who scored a 23 on a MoCA out of 30, so already well into MCI, and she's done very, very well, and now scoring perfectly on her MoCA, doing very, very well. So beware, there will be some people who show up for prevention, but they'll actually be there for reversal. But for prevention, the basics, you want to achieve insulin sensitivity. The diet, I just talked about, KetoFlex 12-3, exercise, sleep, and stress. You want to resolve inflammation, removing the cause of the inflammation and supporting the adaptive system. You want to optimize nutrients, homocysteine, B12, etc., hormones, trophic factors, brain training, whole coffee fruit extract, etc. You want to identify and remove the toxins. The toxins come in three groups, basically, or inorganic toxins, such as metals, organic toxins, formaldehyde, benzene, toluene, things like that, and then the biotoxins, trichothecenes, gliotoxin, ochratoxin A, things like that. And then, as I mentioned, optimizing vascular health and oxygenation, healing the gut, optimizing the microbiome, both the gut and the oral sinus microbiome with probiotics and prebiotics. So the bottom line is, if we can get people to come in earlier, if we can do the appropriate evaluation, get them on the appropriate prevention and early reversal, we actually can make Alzheimer's a rare disease, which is just what it should be. It is a protective response to these various insults, which we can identify and we can address. There are 6 subtypes, and we'll talk about those in just a few minutes. Cognitive decline in Alzheimer's and its forerunners, MCI and SCI, in fact, is reversible. We published on this in 2014, 2016, and 2018, and the book came out in 2017. This sort of a programmatic approach should be applicable to other neurodegenerative diseases, which all seem to have their own biochemical mismatches. So we have to have a different protocol for each one. But the general idea of a mismatch is similar from one to the other. And with this, we should actually be able to reduce the global burden of dementia markedly. And not only that, but increase the global cognitive ability. As Professor Bersnick has pointed out, this is really ultimately going to impact things like airplane crashes and accidents on the road and things like that, because we can enhance cognition. And of course, it will lead to better performance at work. So the bottom line is that just as for leprosy and polio, Alzheimer's shall become a former scourge, and it's up to us to make that happen. All right, next we're going to talk about what is new for RECODE 2.0.